Turn the recording. Hello, everyone. How are you? I'm Violet Lee, and your Tai Chi examiner. Yes, I have written more than 700 articles on the healing art of Tai Chi, Qigong, and meditation. Today, and I'm very, very excited and to talk about a very, how should I say, important topic, near and dear to my heart. And the even more exciting part is my friend and Josh Henkin is here to how should I say, work with me. And Josh is a certified strength and conditioning specialist with 30 years in the fitness and performance industry. He is a highly sought after educator and presenter in the areas of functional training and corrective exercises. He has taught in 13 countries, boy, a lot more than I have ever done, and also at many national conferences. In addition, Josh's work has been published in over 20 national publications, including Men's Health and the Wall Street Journal. Wow. And in the past couple of years, Josh has been learning the healing art. And first he started with Qigong, and then he saw the amazing results. So he decided to go forward with the study. And then now currently he studied Tai Chi Chuan and with me. And because he's so interested in the healing power of the Tai Chi and Qigong, so recently he went to Boston, attended the very first science conference hosted by Harvard Medical School. It's called The Science of Tai Chi and Qigong as a Whole Person Health. So, and he's extremely bright, and he took great notes, and not to mention, he always likes to do research on his part, I guess, for his own fitness and performance business. And how should I say? And he actually invented his own brand and his own methods. So you can understand, he is very serious about being healthy and being fit and so forth. So, and hello, everyone, and say hi to Josh, and Josh, say hi to everyone.
Well, hello, and thank you for the wonderful introduction. I wish I could have that all the time. Thank you so much.
Well, I'm seeing there are some pictures behind you. And what are those? It looks like one says Men's Health, right? And fitness. And are those the magazine which and publish your writing, or they reported on you, or what are they?
Yeah, in the last 20 years, we've been very fortunate that we've gained a lot of interest in how we go about training the body, which has a lot of relationship with Tai Chi. And so, brands like Men's Health, we did a whole training for Men's Health, Muscle and Fitness, Shape Magazine, Runner's World. We've been very fortunate. A lot of these publications were really interested in how we were helping people not only look better, but function better and feel better. And so that's been a wonderful opportunity. We've been able to work with a lot of different populations and help a lot of people that way.
Great. Looks like there are a lot of more pictures.
Yeah, my wife did a pretty good job. She made a nice wall. So
oh, yeah.
Nice job.
That's wonderful. Yeah, well, thank you for sharing. And so as I mentioned, Josh went to the conference, and some of you probably know that I was at the conference as well, and I was actually presenting on 2 different topics. Of course, I'm not a scientist. I'm not really medically trained, and but I was presenting on topics which are related to the healing art. And I found the conference was extremely amazing. I learned so much about it. And as you know, I have been writing about Tai Chi more than 12 years. So I've been following the study and the research and so forth. However, even with this kind of how shall I say, attention to it, I was still very surprised to learn many new things, and many is about not just say Tai Chi Chuan is better than some other exercise, and it's also doing, saying Tai Chi Chuan is great for the whole body health. And one thing and really caught my attention was when the scientist is talking and the people are asking questions, and they say, how much dosage we needed? Right away, I was like scratching my head and say, dosage, what does that mean? Isn't dosage, normally we're talking about, oh, you go to see the doctor, you have certain health issue, and doctor said, yes, you need to take this pill, and how many milligram it should be, and you take like how many times a day, and how many days in a week, or something like that, and that's dosage. And so when people asking, say, dosage, I was really, say, that's very, very interesting. And what, I'm kind of slow anyway, and the Josh was there, and you heard the scientists they're talking about, they keep referring and using Tai Chi and Qigong as intervention for various health issues, right? Correct me if I say anything wrong, okay?
You're 100% right. Yeah.
Oh, okay. Very good. And so you coming from the fitness background, and have you that industry use the dosage much at all, or it was kind of new to you also?
Well, for first, I would not ever say that you're slow. So let's get that out of the way. You are not slow. You're very bright. It depends. In my industry, there's a big range of people. I went to college to be in my industry, so it's a little different for me because my education's a little bit more intensive. So in college, there was a class that we took called exercise prescription. And so that was like kind of the first time it started to pop in my head that basically what we are doing is using movement as a form of an intervention to help several conditions. So just like a medication, like you were saying, you need to know what is the right dosage, how much, how intense, what type do I need to do? So that's why it's very unhelpful generally if a doctor tells someone, well, you need to go exercise, because there's a million more questions you should be asking. Well, what type, how much, how often? And so I think now as Tai Chi's been evolving, and the bigger questions have to be asked like that. So if we're going to say it can be used to treat these different conditions, then the next question has to be the dosage, like what type of prescription does the different conditions require, and will they differ depending upon what those conditions are? So I think one of the cool things that I got out of the conference, and what I always think a good conference is if you leave almost having more questions than when you started. And so I had a million more questions afterwards, so I'm interested to see how the research will evolve to answer some of those questions.
Excellent, very good. And I think you actually helped me to understand better. So I guess, you see, I'm slow. I did not realize that, in the university setting, academically, they already and then using in that kind of a term. And so from the conference, what do you think? What did the scientists actually told us, and how many times, and we should exercise, or the healing hour, or how long it should be each time?
Sure. I think, they were starting to scratch the surface of those deeper questions, because I think you and I discussed this in one of our sessions, in one of our classes, that I think at first Tai Chi had to answer the question of, does it actually help these different conditions? So if we take different populations and we have them go through Tai Chi, do they improve? And so I think that was the kind of the first phase, and that started being a very consistent yes. So then it had to be, well, okay, what's the next question? The next question had to be how much, kind of the dosage that you're referring to. And so I think they're starting to do that, and they don't, I think, have one definitive answer. So it's very common that they came up with a recommendation of 2 to 3 times a week for an hour. That was generally the recommendation. But I think there was also some discussions that came about just in the different sessions too, that generally it was the more the better, in a sense too, that if you could practice more frequently and more often, the results were going to be generally better. Now, that also has to answer a lot of questions, because you are very important. You're a teacher in the real world. I think people have to understand sometimes studies aren't the real world. Very often they're not the real world. If people are short on time, is doing it 3 to 4 times a week for 30 minutes just as good as doing it twice a week for an hour? So those will be questions I think that they'll have to answer in the future. Things like different forms. Are different forms better, or certain forms better than other forms, or styles? You and I were discussing a research study that actually called Chen style kind of resistance training Tai Chi, which I thought was interesting. So a lot of the research is looking mostly at the Yang form. So if we look at different styles, do those results change, and do the recommendations change? So right now, I think the standard recommendation is pretty good. It's 2 to 3 times a week for about an hour, which seems pretty doable for most people. But that may change as we start asking different questions and start comparing it to different other forms and different practices.
Very good. And I don't know, Josh, can you see my screen?
Yeah. Mm-hmm.
Well, okay. And these are some of the slides that you and I, we took pictures, when we in the conference. And this one, I think it's pretty cool. Okay, they say TQ means Tai Chi and Qigong. And what is it? Tai Chi and Qigong. So is meditation in motion, or is medication in motion? So back like 20 years ago, everybody was saying Tai Chi Chuan is a meditation in motion. Of course, meditation itself has a huge health benefit. And but now I would say about 10 years ago, they started talking about Tai Chi Chuan is medication in motion. So because we keep moving our arms and legs and so forth, and then it actually has a therapeutic and healing power. So, and I like how they did it, and they put this into the pill form. So with that kind of image, I think probably help people really. I mean, that they try to drive into to everybody's brain. Yeah, it is. It's like you're taking a pill, right? So then, and let's see if I can. Why I cannot advance my slide? Okay. Okay. So here is another one, and this is talking about a cognitive function, and it's a randomized control trial. And so the result is, and then they are doing the Qigong and improving processing speed and sustained attention, all those kind of things has great effect. So I'm not, and there's an increase hippocamp volume, and that's huge. That's good, really, really good for our brain, and reduce peripheral this IL-6 level. And again, this is a positive things to have anyway. So that's that associated with the processing speed. And when we're talking about the executive function of the brain, and that's good. And so now let's look at it. Say, okay, some people say, well, so how long did they do that, and so forth. So actually, they did for 12 weeks. And total of 36 hours of training. That means they each week they do 3 hours, right? And then the 30, and then they, how should I say, the participant, they also do 30 minutes during the no training day. Say no intervention day means they don't really, how should I say, gather everybody together and do the classes. So basically, you do 1 hour each time, and then outside that you do 30 minutes. That's one, how should I say, example, and they get great results. And here's another research, and then so they do the so-called 3 days a week for 8 weeks, and again, because the budget issue or the funding issue, they cannot really do very long study. But the amazing part is even they do a short training, and they got great result. And then in this training program, they do 10 minutes warm up, 40 minutes do 18 movement of Qigong, and that's Tai Chi Qigong 84, and they do warm down. And so they see significant improvement in attention and processing speed. Again, it's about the brain. So when we're doing the healing art, it's not you're physically and then doing exercise. Actually, is your brain is like on a treadmill. And so the amazing part is, so after the 8 weeks, they ask everybody stop doing anything, and then they continues to monitor and their condition. And but there's some sustaining power of their training, and then it lasts until 12 weeks and back to the original. So that's another very neat thing. And here are more, and then this is there are actually there are about 20 studies, and so you see the frequencies a little bit different from 1 to 4 times a week, overall training program from 10 weeks to 1 year, and the duration and for each one. And then, you know what, sometimes it's as short as 20 minutes but as long as like 120 minutes, that's 2 hours. That's pretty long, right? Would you say that, Josh? So you see it's all over, and I think that's very much like what Josh, you were saying earlier, and maybe because the different form and style people do and have different results. And I really like this part. This is done by the Tufts University under the leadership of Professor Chen Wang, and is using Tai Chi versus aerobic exercise for fibromyalgia. And some of you probably know fibromyalgia is a disease mostly women suffer from, and some men, but not as many as women. And your muscle just ache, and there's so much pain, and people cannot sustain. And what's interesting is here, and let me just go through very, very quickly. So they do it twice in a week versus once in a week. You see this yellow line is doing twice a week, and this is once a week. The purple, okay. This is a little bit, how should I say? Josh, help me out, okay? And so
I mean, I think it makes people think that if you do it less, that you get a better result. But the one thing I do want to say, especially with a condition like fibromyalgia, which can be an autoimmune disease, when you're looking at research with like anything pain related, it can be complicated. I actually talked to one of the researchers about this, because pain is a subjective measure, right? You and I could have the same condition, but have very different feelings about that condition. So what they'll also do, it depends what they're looking at too. I think this was actually one of those examples, is they'll look at your disability, like how much can you do? Because pain can be bad on one day and good on another day, and it can be kind of up and down. So rather, what researchers like to do is they like to look at, yes, they'll look at pain, but like quality of life and well-being. Like, are you able to do more during your day? or are you more restricted? So that was part of the scoring here. So it's not, I don't want people to think like because they did it once a week, that's better than doing twice a week. That could be misunderstanding kind of the research. And also, like, if you're doing it once a week and you're doing the 12 form, like I don't remember if they really broke down how it was taught, because if they had twice a week, maybe they were doing a different teaching session a little bit differently than if they did it once a week.
Very good. Thank you. Thank you for the explanation. And so, but overall, we can see this picture, and this dotted line is aerobic. And then, so this FIQR score is the like Josh was talking about, the pain, how much you feel. And so people practicing Tai Chi, you see, is much lower than people doing the aerobic. And then another thing is, you know, the study either 12 weeks or 24 weeks. And you see with Tai Chi Chuan, and then they continue to have the residual value up to like 52 weeks. Even at 52 weeks, it's still lower than their baseline.
Yeah, and I think that was really interesting because I think they didn't get into it, but you mentioned it early, the leukin 6, and what that is, if people don't know, that's a sign of inflammation. So usually people most people with autoimmune diseases have higher inflammation markers. And so what's happening here was that yeah, right. You know, when you're seeing there, when you see those decreased leukin markers, that's decreased inflammation in the body and the brain. So people with fibromyalgia usually have higher inflammation markers. So when you are able to decrease those inflammation markers, what I thought was interesting, like you said, it continued to be low for about another 6 months, even though they weren't anymore. So that means there's actually some residual benefit that's going on metabolically and physiologically, that the inflammation is being suppressed by doing the 12 was it the 12 weeks or 12 months of practice?
12 weeks.
Practice. And so that's really interesting too. And when you look at the cognition too, because I don't think a lot of people know about, they estimate about 80% of doctors' visits in the US now are basically stress-related visits. Like there's symptoms of stress. And so if we can lower inflammation, and if the brain thing was interesting too, because what they're showing is that when you do Qigong and Tai Chi, so a lot of us, the more stress we get more into what's called our limbic system of our brain, which is like our more emotional brain. Like when you're really upset, and then you lash out and you said, oh, I didn't mean to say that. You know, that's kind of like our emotional brain. But our prefrontal cortex is what sort of calms us down. So there's actually showing more activation of that prefrontal cortex. Like that's your rational brain. That allows you to make better decisions and react better. So I think that's why we're also seeing such a benefit to some of these autoimmune conditions like fibro, is that we're seeing those changes actually stay for a longer period of time, even after people stop practicing.
Thank you so much for the explanation. That's very good. And so here is a different study. This is Tai Chi Chuan, the effectiveness of Tai Chi Chuan versus physical therapy for knee osteoarthritis. Again, you know, and here the more solid line down here is Tai Chi, and then the dotted line is PT. And so they looks like the study is end at a 12 week. Okay, that's the intervention duration. So it's only 12 week. But again, the residual factors and the lasting much longer. So very good. And the same, you know, with PT. So in many ways, these two lines looks similar. So have a very similar value, and at least Tai Chi Chuan, unlike some people think, oh, I'm going to get a physical therapy, and but instead you can do Tai Chi Chuan and get the same effect if it's not better.
Actually, no, what's really interesting about these last two studies you showed too, Violet, were they were comparative studies, meaning that you were comparing Tai Chi to something. Right, the last one was cycling, and this is the physical therapy, which is really interesting because that's what people want to know, right? Is it just exercise, or is there something unique about Tai Chi. And so I think they're showing that there's something unique to Tai Chi because, like you said, it outperformed the aerobic exercise. And here, even though the results in pain were similar, I remember this study. The study actually went on to say that even though the pain differences were rather similar, they were both able to improve pain. The Tai Chi group actually reported having less disability from the osteoarthritis. So that's
Oh,
why I said, like,
wow.
just relying on pain can be difficult in research because people can interpret pain differently because it's subjective, but they can look at functional tasks, like how able are you to do certain things. And the Tai Chi group did actually better, which is pretty astounding compared to physical therapy, because that's obviously very much directed towards trying to help osteoarthritis.
Excellent. Thank you very much. And some people may know because I had to catch the plane and I actually missed this part of the conference. So this is great. And you are actually there. And so again, here's another studies. And actually, you can see, you know, this is Tai Chi for hypertension, right? And then so it's about 12 weeks or so, and then most is less than 6 minutes, and was 5+ week, and we see, you know, the intervention, and it all have a great results. So showing you these slides, and basically you can see it's kind of how should I say, not say all over the map. There are different, some are shorter and some are longer. And a lot of time, because their funding issue, they are not allowed to do for too long a period of time, or they cannot have too many sessions either. I mean, too many sessions each week. However, overall, and it's all very, how should I say, effective. And then we said, well, it's all very effective. How about I just do like 20 minutes each day, and I do once a week. So I know a lot of people probably would think that way. And so what do you think, Josh, about that kind of thinking?
Well, I mean, I understand where people are coming from. So, I mean, there's two things to consider here. One was that the researchers were generally saying that they saw overall, the more that people could do, the better the result was going to be. So that was kind of a general theme. But at the same time, you know, you're a teacher, you can speak to this even better than I can about teaching Tai Chi. Is like, also, what can people actually devote in their lives? Like, if you say, like, in that last, say, 5 days a week for an hour, well, that might overwhelm people, and they may, I can't do that, so I can't do Tai Chi. Well, we don't know if you could get a really, really good result from 3 days a week for 30 minutes. That might be more doable. So I think it's, you know, meeting people where they're at, like, how much time can you devote? How much can you realistically do? Because I think the most important variable that I started to pick up on was consistency. If you could be consistent with the practice, you're going to get a good result from the practice. If you're doing it once a week, I don't think that's going to be enough of a dosage. That's like saying, let's say I need 200 milligrams of, you know, ibuprofen. I'm only going to take 10 grams. It's not going to be enough, right, to help your headache. So I think it's just, you have to find what's realistic for you, but you have to build some consistency and some frequency. I'd say, I mean, you're the expert more than I am here, but probably at least 2 to 3 days a week would probably be ideal if you want to get a change in some of those conditions.
Well, thank you. And I don't claim I'm an expert, but I have seen enough evidence, because I have taught several thousand people in person. It's not like online, because I have taught more online, and I don't track their results whatsoever. But the people I actually work with, and I see various results, and some were just amazing. And of course, and they also have a big needs. Some people, they are suffering from certain health issue, and they will do more, and then they get help. And some people, they don't do as much, like you say, because everybody's lifestyle is different. but the little they do, and then they've been helped. So that's also a very good, yeah, to know that. And I don't know, Josh, you have some personal experience. Do you want to talk about it, or?
Sure. Yeah. I mean that might be really helpful for people to hear, because I'm a prime example of, there's no way I could have done 5 days a week for an hour, even if I really, really wanted to, when I first began to practice, because I got into Tai Chi. Basically, I have a very aggressive degenerative spinal disease that started, was first diagnosed when I was 14 years old. And so in the last 10 years, I've had 7 significant spinal surgeries. I've had to relearn how to walk twice. And I still only have about 60% use of my right leg because of the nerve damage that was done from the disease. So I'm recovering from one of those very significant surgeries, and I'm just kind of at a low point, right? Because there's also a very high emotional demand or cost when you go through those surgeries. I don't think people know that there's numbers like over 50% of people that go through any type of surgery get PTSD. I went through 7 and 10 years. So I definitely had PTSD, I had depression, anxiety. I had all those fun things to go along with it. And I couldn't be very physically active because of the surgeries. And I was looking around on the internet, like, what can I do? Because not being able to be active was a big deal to me, because I've always been active in some form. And I got Dr. Peter Wayne's book from Harvard Publishing. And that was like seeing, we joke that, Violet's a nerd, but I may be just as big of a nerd. Having some science to go along with the practice, I think really intrigued me. Yep, that's the book right there. And the fact that he gave some science to, like, why would this work? Why would this possibly help me? Intrigue me. But so I go, okay, I can't really do much, but let me try this. And maybe this is where you can, speak to a lot, Violet, is as a consumer, I didn't know how to find a Tai Chi instructor. Like, what do I look for? Who's good, who's not? Because my biggest fear was, would there be someone who could work with someone like me? And I'm sure I'm not the only one that gets that concern. Like, can I be helped? Can you work with me? And I didn't want to do a class because I didn't want to hold up the class, because I didn't know how much I could do. So I started off with just literally, there was a free online, like 5-minute lessons. And I was just doing 5 minutes. But that was a lot it was a lot for me at the time. But I enjoyed the 5 minutes. So I started doing them every day. And then I would do them a couple of times a day. And I would slowly build it. Even when you and I started working together, I had significant issues still. You saw it with my balance and stability. I was still having issues from the surgeries, but it was finding what I could do consistently. And I wanted to practice every day. Like, to me, that started being the time that I felt most calm, most at peace. I enjoyed. It wasn't work for me. It wasn't like a typical workout where you're like, oh man, I'm dreading this. I'm like, this sucks. I don't want to do this. It was something I looked forward to because I always felt better. And it got to the point where I got off all my pain meds, and not because I don't have pain anymore, but because I can manage it. I know the practice helps me manage my pain more effectively than the medication does. So it's not that things always go magically away. It's that sometimes you learn how to manage it better. And maybe you can speak to it too, is also embracing the philosophy behind Tai Chi. It's not just the active movements, but the mindfulness and the idea of balance in life that was very helpful for me and allowed me to build up. Now I'm kind of obsessive. Now I think I practice minimally an hour a day, but partly because it always makes me feel good. And it's not because I'm trying to lose 10 pounds or I'm trying to look a certain way. It's because I always, if I feel like if my pain starts to elevate, or I feel that anxiousness start to, come up because of life, I know if I do even just 10 to 20 minutes of practice, I'll feel better. And so sometimes too, you can accumulate time if you do smaller chunks throughout the day. I know I'm very fortunate. I get to work from home, so I can take a break for 10 to 20 minutes and do stuff. But I think a lot of people can do very simple things, even if they work at the office or if they are at home. And if you do consistent little breaks, that starts to add up to those benefits.
Excellent point. And yes, so if you cannot afford, like, say, 30 minutes, or not to mention an hour in a day, and don't give yourself excuse. I'm not practicing it, right? And I think Josh offer a very great advice. You can and break them up and into chunks, 10 minutes a time, 15 minutes, and it accumulates. And so that's really, really good. So, well, thank you very much, Josh, for sharing your personal stories with us. And didn't you tell me at the very beginning you practice 2 hours every day, right?
Yeah, no. I mean, and then for me now at this point, now I'm at the dosage part where I go, am I doing too much sometimes? And I think you've
you can never do too much.
I think like
It's
sometimes
how you balance,
you probably have
balance
balance
your other.
sometimes.
Yeah, yes.
Like
Yeah,
if I push
definitely.
myself too much, like having balance, I think is key. So I always try to remind myself of the philosophy when I start getting a little frustrated with myself, of like having that balance of why am I really doing it, and bringing back to those important points. But I almost want to say too, I thought like one of the only downfalls to the conference was people like yourself didn't get the platform to talk about being teachers enough, because science studies are not reality. Because you mentioned it, like the funding that goes on in the study, people are not paying to go to class. They're getting paid to go to class a lot of times, and they pay for the instructors. But like for you, like if you have someone that comes in with fibro or back pain or hypertension, I think they should have given you guys an opportunity to say, what do I teach them? What is the priority? What should I be learning? And I wish they gave you guys more of a platform, and hopefully that will happen in the future.
Well, yeah, we certainly hope so. And then, one thing I do want to mention in in the studies that they presented, they have used all different kind of Tai Chi and Qigong forms. Some are more difficult, challenging than the other, but it all seems have end with great results. So that's a good thing to know. So for some of the folks out there, if you will, don't doubt and say, "Oh, is the one I'm learning really useful?" I think the probably you can think about it as if the instructor is good enough. If the instructor is good enough and then can convey to you all the important elements, the fundamentals to you, then the form itself may not be as crucial. Yeah.
Yeah, I mean, maybe you could take a moment to say what makes for a good teacher, because I remember what I did was I was going online and I met Shirley, who was great, but we were at a distance. So it's much hard to learn at that distance. And she said, hey, you should check out this online Qigong conference. And that's the one you were presenting at. And I listened to you, and you mentioned you were in Vegas, which is our backyard. And I'm like, just hearing you speak about it, I could tell you understood it. But other people I had looked up in our community, when I looked up Tai Chi, I didn't get the same feeling all the time. So I don't know if you have any recommendations of how do you find a teacher that is reputable and you can trust?
Well, I think the easier way is see if you can audit a free lesson to begin with. Of course, sometimes it's hard for the teacher afford to do a free private lesson, but at least you can, first check out the person's credential, their lineage, and who they learn from. And then second thing, see if you can audit a class. And you feel, yeah, it sounds like it makes a lot of sense or whatever. And then you can try it. So yes, it is difficult because there's so many different Tai Chi and Qigong style forms, and everybody is not trained the same way, and their experience may be different. So I would say, just do your homework and then check the instructor out, and then see if the instructor is even willing to offer a free auditing class. And thank you so much, Josh. And I think this is fun, and I really appreciate that you're willing to share your personal story with us. And any final words and to share?
I think, what you said was really important, that if you're interested and you want to help solve some of these problems, I'll never forget, you were very honest with me when we first met. You said, I don't know how you'll end up feeling, but let's try. And you were very much willing to look into different styles that would be appropriate for me. And I think, you always emphasize having patience and, starting with whatever I could do well. So I think when you're looking to solve a health problem, understand that it's not a magic pill. And one of the best things I think about Tai Chi is it empowers you to take care of your own health. And I think that's really important because people try to outsource their health to doctors or other people. So knowing that you can control your health is important, and how it starts to flow into other positive habits and better sleep, better stress management, better eating habits. So I think, I hope it continues to get a positive platform like the conference offered it, and great teachers like yourself get to be featured more and more.
Thank you. And well, one thing you did just say that, and I think it's very important, because Tai Chi and Qigong both are so-called internal art. And we really need to be mindful about how our body feels. And then we are not just mimicking the movement. And then that's not good. We need to understand how it will work, and then how our body feel. If it's the body doesn't feel right, maybe something you're not doing it right, or maybe, for example, I have a lot of students and who had physical limitations and certain things they cannot do, but they were very honest with me, and so I can help them and tweak here and there if needed, and without sacrificing the benefit of practicing it. So again, well, thank you so much, Josh, for coming, and I really enjoyed our talk today. Oh, by the way, everyone, and Josh wrote a very nice article and regarding the pain management, and after attending the conference in Harvard, and he had a lot of great information in the scientific studies that's all being included. So it's almost like an academic report, but it doesn't read boring. It's interesting. So you can read it if you have not read it yet. And I can just look down at this, how should I say, and video, and I will have the link there for you, okay? And if you have any questions and comments for me or for Josh, and then you can always drop us a note, okay? Thank you so much, and thank you for coming.